So although ER-positive breast cancer generally has a good outcome, there are certainly a sizable subset of patients who relapse from this disease and can develop quite aggressive disease or even experience late relapses. So it really is important that we find new targets that take out the more aggressive types of ER-positive tumours. One of the things that our group and others have found is that BCL-2, which is a survival protein, is expressed at high levels in ER-positive tumours. And although in breast cancer it seems to confer a good prognosis, it also offers the potential as a therapeutic target. So it's expressed in about 85% of ER-positive tumours, and as new drugs are being developed that can specifically and very sensitively target BCL-2, it represents a new therapeutic opportunity. The class of drugs that are recently been developed by a number of groups known as BH3 mimetics. So these mimic the sensor proteins which normally are activated when a stress signal hits a tumour cell or a normal cell and initiates an apoptotic cascade that eventually kills the cell. So BH3 mimetics have been designed that copy this process and essentially bind to and neutralise BCL-2 and therefore take out its survival function. What our work has shown is that it seems to require an additional signal or additional event such as chemotherapy or hormone therapy to help these BH3 mimetics kill cancer cells. So in early studies that have been looking at leukemia, single agent treatment with BH3 mimetics are showing considerable promise, particularly against diseases like chronic lymphocytic leukemia. Our studies and the work of others who've looked at breast cancer cells would suggest that you probably need to use another targeted therapy with a BH3 mimetic, and in that setting we've explored tamoxifen with this new class of drug. What we found was that the combination therapy was much more effective in killing ER-positive cells which were BCL-2 positive than just tamoxifen alone. And this was using tumours that had been derived from breast cancer patients that were grown in laboratory models as PDX models or patient-derived xenografts. The first thing is that we have to be cautious about these findings, but my feeling is that they're very promising and that they certainly need to be tested in the clinic. So the work that we have done has been at the preclinical level, looking at patient-derived xenograft tumours, but there is sufficient evidence from those studies, I think, to now test these new drugs in the clinic. And we've actually initiated a phase 1 study that will be looking at tamoxifen and BCL-2 inhibition with venetoclax, or otherwise known as ABT-199, in the clinic for patients with metastatic breast cancer. So I think certainly these drugs are not ready for prime time. They haven't been approved, but testing them will happen in the relatively near future, and so hopefully that will show some promise that can be taken further in the clinic. The challenges will be to work out firstly whether the drug actually works in patients, and secondly understanding which combination therapy will be the appropriate approach to use. So our modelling has used tamoxifen, but there are of course more potent classes of endocrine therapy out there which include the aromatase inhibitors and agents which degrade the hormone estrogen receptor such as fulvestrant. So it's going to be important to know whether these show similar promise and would be worth pursuing in the clinic as well. The other thing is see whether or not there is merit in targeting BH3 mimetics in combination with other drugs. For example, our work has shown that mTOR inhibitors are very effective and synergise with the BH3 mimetics. And these are drugs that are already being used in the clinic for breast cancer. So the question will be which combination of drugs is the most promising. I think the Congress has been really helpful in bringing recent discoveries to the forefront to allow delegates to gain an understanding of what's here and now and appropriate clinical practice, but also what new developments are coming from basic biologic discovery. So I think it's been a very worthwhile gathering.